our strategies are working for us. We want to remain relevant in this community, relevant in the region, and for me, that starts with the people that you work with and how that all translates. In the future, I wanted to talk to you just briefly about things that I see coming. We're going to continue to explore how to impact the social determinants of health. These are things like food, housing, economic and social relationships, transportation, education, access to care. These are really the focus of when I talk with Dr. Ruick-Geisinger, these are the things that he and I talk about. What can we do in this community and in this area that we jointly serve to affect these things that really determine long-term the health of an individual and their access to good care. When it comes to healthcare reform, I've decided I'm just going to say these things that I think might get asked more from a political perspective. I really don't comment too much about healthcare from my role when it comes to what I personally believe. What I believe as an organization is whether it's a modified ACA or Obamacare, whether it's repealed, whether it's Medicare for all, whatever it's a hybrid of, the bottom line for a hospital like me is we're going to treat people regardless of what those things are. We'll adapt to whatever we have to, but we're here to take care of people. I will say that a lot of what I believe is that the healthcare system is broken in many ways, and it's a huge problem. I don't know that I believe fundamentally that our country has really debated, is healthcare a right or is it a privilege? And so they set about designing plans to try to fix pieces of it, and people get mad at Geisinger, they get mad at Evan, they get mad at their local providers, and a lot of what's broken in healthcare is through insurance companies. It's through the cost of pharmaceuticals, the cost of the knee that you get put in. There's tons of areas where there's problem, and I really think you almost have to strip back to the basics and somewhat start over again. I don't know if that's possible, but for me, we're just going to take care of people, and we're going to figure it out based on whatever the rules of the game are. I just think what you have to talk to people about is getting their facts from credible resources. A lot of things that get asked of me, I'm like, where did you hear that? You have to get credible news, credible resources, and I know that's one of the aims of this entity. I will say there's two things I'd mention to you. If you see legislation out there and can give support, workplace safety legislation is out there. My name badge has my name on it, my first name and my last name. I don't deal with direct patient care, but my last name is small. The goal is to get caregivers and people in hospitals to get their last name off of these, because very clear data about the kind of violence that happens in the workplace. You can't believe, I'll tell you a quick story. I have an employee who came to me, didn't know what to do, very attractive nurse in the ER, and a colleague of hers shows up to work and says to her, hey, it's kind of embarrassing, but I was on a dating website before I came to work, and here's what I saw. And it was her picture attached to somebody else's dating profile. Long story short, she was taking care of another woman, and the woman snapped a picture of her unbeknownst to her and then put it on her website. And when they got through the whole thing, the bottom line was, she said, she's more attractive. I got a lot more dates coming after me than I did with my own photograph. We have to help the workforce do that. That's not a violence thing, but this is kind of the invasion that you have, and the camera that you have at your fingertips at any given minute. But there's a great deal of workplace violence, and we support the workplace safety legislation to try to get last names off of name badges. And then telemedicine. Geisinger's a pioneer in telemedicine, but there needs to be more access to telemedicine, and the insurance companies need to pay for telemedicine visits. And in a rural setting, this is very important to us. And then lastly, in the last 2 days, it came out about price transparency and putting all the pricing out there of your services, as well as what the insurers reimburse you. And all I would say to you is I certainly believe in sharing prices, but it's when I talk about the broken system, it's very complex. And right now, all of my payer contracts say I'm not allowed to tell anybody else what I get paid from them. And now they're saying you got to put it out on a website. So there's a lot more to come on this price transparency, but we all believe we've got to do our parts to drive down the cost of care. But I would say that local hospitals, in particular local providers, we take hits because we're the place that the public can go after. We're right next door, But a lot of the issues come about from other areas. So, you know, these are complicated matters to resolve. But I want to, you know, answer any questions today and leave here saying I think Evan's in a good spot. We have a good partner in Geisinger, but we remain independent, and we're going to try that for a period of time, and certainly very grateful for the support that we get from the region and from the community. And we have a solid workforce, and I believe that's the future of the organization. So does anybody have any questions? That was a lot of information, I know. You have a mic, okay.
I have a mic which I'll take around, and hopefully it's working. I just want to highlight one thing that I'm aware you did, which is before the last election, you used your platform with your employees to encourage everyone to vote. So here at the League of Women Voters, you know, totally appreciates a major employer in our region getting behind the message. What's more important than being engaged in who represents you, and we thank you for that.
Oh,
So who
thanks.
has the first question?
You touched on this a little bit, but I wonder if you could expand on the impact of the ACA on your hospital.
Sure. I think what we saw with the ACA was that people had insurance, all right? And what we saw the drop in the uninsured, but we saw an increase in some of our charity care and bad debt. We didn't see it quite drop off the way that we expected because people had high deductible plans. And some of the high deductible plans, I mean, it's one thing if you have a $500 deductible that you have to meet, but if you have to meet a $10,000 deductible, you just don't have that money in the bank. So we were still rendering care and still providing services that we weren't getting paid for because people don't have that kind of money.
Did you find more patients coming into the hospital? In other words, more access, expansion of access?
Yeah, that was the upside of it. I think more people were seeking care, more people were getting preventative tests. You know, we all work really hard to do education to get people to the right place for care, trying to educate, don't just, you know, if you're skipping a primary care physician, just don't skip right into the emergency department, go to urgent care. But what happens when you can't pay is you don't go to your clinic and you don't go to urgent care where they ask for the money up front. You go into the emergency room, and it just starts the cycle of expensive, you know, and the bad debt. You're just circling all the time and not getting paid. But, you know, people need to have health insurance. They need to be able to have access to care. And if they don't, we provide the service. That's our mission. That's what we're going to work to continue to do. But again, I always hold, I think, that's the debate. You know, is it a right or is it a privilege? And then figure it out from there. But I think that you saw, I think when you deal with health insurance, it's so complicated, but you have to be in it for a long time, and the risk pools and all the different people that jump in with their premiums, you have to have young people in those risk pools to support people as they age and get a little bit more unhealthy, and some of those things were just starting to hit their stride, so you really can't necessarily ascertain whether or not it was going to work in the way that it was originally envisioned, but that's the nature of our political system. The next round of people come and then it changes. And I just hope someday we decide as a society, you know, is it a right or is it a privilege?
Another question? I've got the mic.
I've got a question. No one else.
Get back to you.
Why don't you just keep the mic? This is just a minor thing. If you go back to the slide on employee engagement,
Yep.
could you describe what the different colors meant?
Sure. So what this is this was just showing